All right, for the postpartum assessment, first thing I would do is introduce myself to the patient, let her know that I'm a nursing student and what I'm going to do during the assessment. I would go ahead and do vital signs. I would first check her blood pressure, but since we don't have any equipment, I'll just pretend. So I go ahead and place a blood pressure cuff here, make sure that it's in normal ranges. Next, I would go ahead and listen to her breath sounds and just make sure that it's okay that I lift up her gown to put my stethoscope underneath here. I'm just listening to her breath sounds. Also listening to heart tones, and then I would go ahead and check the apical pulse for a whole minute. I would ask her also about her pain, just asking if she has any pain maybe in her incision, if she had a C-section or from her episiotomy, if she's having any other pain elsewhere. I would go ahead and ask if I could lift her gown up so I could go ahead and check her breasts. I would go ahead and just feel around, just making sure that they're soft. If I would feel any hard spots, I would document that. Ask her if she's having any pain, and if she's breastfeeding. I mean, that could be normal with the first couple of days of nursing. I would check both nipples just to see if there's any cracking or any bleeding. That could be common in the first few days of breastfeeding as well. I'm just making sure that everything's intact. Next, I would go ahead and do the bubble HE, and I'm just going to go ahead, well, I already did the breast, so next I'm going to go ahead and do the uterus. And I'm just going to check the tone, just making sure that the fundus is hard, because you don't want it to be boggy. That would feel like a Nerf ball. That would be a cause for concern, because you want the uterus to begin to contract so you can make sure that the uterus is going back down to its normal size that it was before pregnancy. So I'm going to go ahead and just check her uterus. I'm also going to note the position and the height. Just going to check, use my 2 fingers, place my hand right above the pubis and then right below the umbilicus. And it should be 1 finger breadth. Next, I'm going to go ahead and listen to her bowels, just making sure that they're active. And I would listen in all 4 quadrants. I would ask if she has passed gas, especially for a C-section mom, that's important. Ask if she has had a bowel movement. A lot of moms will be afraid to have their first bowel movement after a baby, but just reassure her. Ask her if she's had any constipation. I would also ask her the last time that she's voided, just making sure that she is trying to get up and go to the bathroom every 2 hours, just because with your uterus, you want to make sure that it's going back down to normal size, and if your bladder is full, it can push your uterus back up, which can cause some bleeding, discomfort, so we don't want that to happen. And also I would ask if she is familiar with how to do a fundal massage. I would just take her hand and just have her locate the fundus. Well, I would show her where it was, and then so she could feel what she's looking for, and then just massage it.